Hello, my name is Biz Steinberg and I serve as the CEO for the Community Action Partnership of San Luis Obispo County here in California. I want to welcome you to our presentation today entitled Customer Input, Involvement, and Community Engagement Strategies. This is part of our Pathways to Excellence standards, and we are pleased to share this information with all of you across the country today. It is from funding we were granted from the Community Services and Development Department in California in Sacramento that we are able to produce this presentation for all of you to view in your agencies across the country. We recently prepared and presented this information at the CalNEVA conference, held also in Sacramento. Please enjoy this very important standard and the examples shared by my colleagues Grace McIntosh, Bob Ellis of Community Action Partnership, San Luis Obispo, as well as the material that has been also prepared by Denise Harlow from the Community Action Partnership at the national level. Collaboration is key to this training event, and I hope you all enjoy and gather information to apply in your own community action agencies. Thank you.
Thank you, Biz. Welcome, everyone. My name is Grace McIntosh. I'm the Deputy Director here at Community Action Partnership of San Luis Obispo County, or CAPSLO, as we are called. And I want to welcome you to this video, which draws upon a conference that we just completed up in Sacramento, California, focusing on customer input, involvement, and community engagement. As Biz mentioned, we received funding to conduct this training and technical assistance conference up at the CalNEVA conference in Sacramento in April of 2014. In addition, this video will draw upon what was gleaned from that conference, and it's a two-part series. In the first part, we will talk about the actual theoretical assumptions behind customer involvement, customer input, customer engagement strategies. And then in the second part, we will have a live demonstration from two of our peer leaders at our Paso Robles Teen Center who talk about how they developed a wonderful teen center in northern San Luis Obispo County based on getting input from the teens themselves and how they brought that all the way up to our board of directors and got funding to make the teen center a reality. The objectives of this session are essentially to verify the basic assumption of community action agencies, and that assumption is that of maximum feasible participation. And that is really best exemplified by our tripartite boards. Our organizations are actually run by those who represent our low-income community. Our tripartite board structure guarantees that the voice of those we serve will be heard at the policy-making level all the way through to the service delivery level. We're going to identify the value of incorporating customer input, again, at all levels, and understand where the organizational standards which are required of all community action agencies coming in 2016, to understand what components of the organizational standards address the issues of customer input, involvement, and assessment. And then we're going to identify actual examples and provide you with tools that you can hopefully take back to your organizations as you look at implementing these standards. So the organizational standards, and hopefully you know them, there are 56 of them. And these are going to be required for all community action agencies, as I said, in 2016. And some of the more challenging of the standards have been around consumer input and involvement. And so how do we guarantee maximum feasible participation? Ideally through customer input, engagement, and assessment at a variety of levels. So as we begin, I wanted to start with a quote from Sergeant Shriver, who was the father of the entire movement around community action. Charles McCann, who many of you may know, the man with the infamous bow tie, was asked by Denise Harlow at our national to give us a quote that would best exemplify community action. And here's the quote. "First we say don't prejudge the poor. They have much to teach us all. Second, don't prejudge the so-called establishment. It has the capacity to listen, to respond. And third, don't cry failure at the first sign of controversy. Many well-meaning people say, why ask the poor how to conquer poverty? If they know, they wouldn't be poor. It's all right for them to have jobs in the program, but they shouldn't design the campaign. To which we reply, when a man goes to a doctor, the first thing the doctor usually does is ask, what's wrong? How do you feel? That's what we're asking the poor. Where does it hurt? We have to ask these questions and keep asking them. And that is what involvement of the poor is all about. What is community assessment? It's gathering input, obviously, from our customers, our partners, and other areas of the community. So when we talk about our customers, obviously those individuals and families that we serve, but our customers are also others. Our customers are our employees. Our customers are our community partners, those organizations or individuals that help us to reach those individuals in the community that we serve. Our customers are also our funders, individuals, organizations, grant makers that look to support us as we continue our mission of serving low-income individuals in the communities that we are in. Ideally, gathering customer input is more than just going to the census data or asking required community action plan questions and focus groups. It's more than that. It's really utilizing the community input in identifying needs and resources where they're at. It's connecting not only what we're gathering in terms of information to what we're going to do with that information. It's connecting the dots, and that's what community assessment is truly all about. So community engagement, what is that? It's about really engaging our customers in the work that we're doing, engaging them from the very beginning in the planning and development stage, all the way through to the decision making and then analyzing the data in terms of the decisions that we've implemented ideally. So identifying the level of engagement of the community in agency planning and decision making, getting that vital customer input. And again, remember, our customers are internal customers, external customers, meaning funders and partners, as well as employees. And identifying the level of engagement in community-wide projects. So not just looking at the individuals and families that we serve, but how are we impacting the greater community in what we're doing. And finally, consumer input and involvement. We're going to talk about the ways that consumer input is solicited by an organization. How specifically are your consumers involved in gathering information? Are they involved in the information gathering process? Are they involved in broader community activities? And are they engaged in any decision-making processes? If you look at most organizations, conduct customer satisfaction surveys. Some will do focus groups. We actually had one CEO who shared with us that on occasion he will go out to his homeless shelter and talk individually with people to see what they're thinking, what their thoughts are about how the agency is doing. So there's a variety of ways that agencies can gather consumer input and involvement. But more importantly, it's what you do with that information. And that's where a lot of agencies struggle. So how do you, in a consistent, systematic, and ongoing way, capture your consumer input and then put it to work? So hopefully we will be able to address those as we move on. But before we get to the nuts and bolts, I'd like to have Bob Ellis, also here at Community Action Partnership, to spend a few minutes talking about organizational cultural change. It's very important as an organization to periodically look at your organizational culture, which oftentimes doesn't really get addressed, and yet is very important when you're looking at making strategic planning decisions, at looking at changing how we do business, so to speak. So I'm going to have Bob Ellis come and talk a little bit about organizational change.
Well, thank you, Grace, for introducing me. I'm Bob Ellis with the Community Action Partnership. And I'm going to cover a number of things about our mission and what we do as an agency. And then I'm going to talk about some changes. I'm going to introduce change to you. And then Grace will talk about the changes that we made, but some of the things you need to look for when you enact change in your agency. So the role of the Community Action Agency mission, it tells us what we do and why we exist. So why do we exist? We are community action. We are here to change people's lives, and we are here to engage in ending poverty And that's our primary mission. So we need to remember that our mission is to change people's lives. And it also tells us something about how it drives us to look at outcomes and look at results. And those are very important to remember when we look at our mission and look at ourselves as a community action agency. So who are we? Our mission defines who we are. Our mission gives us the focus and clarity to do what we do as a community action agency. It allows us to also provide a clarity of value of what we do and allows us to express that and communicate that to our stakeholders and to the community at large. We want to make sure that our mission, as all of you probably know already, that our mission is concise and to the point and really talks about why we exist. Now, I know a lot of you know who Drucker is. Peter Drucker is a famous management expert who talked to us and really informed us about our customers. And there's a couple things he talked to us about our customers. He told us to look at who our customers are. And he defined them in two different categories. First of all, he defined a primary customer, and that is a customer who will receive the direct services from us as a community action agency. But he also defined another customer, and that was the supporting customer. And those are the customers that don't directly receive those services. They could be a family member, they could be a stakeholder, they could be a business downtown. They don't receive the services directly, but they are affected by what we do. We call them the supporting customer. But some other things that Drucker really tried to emphasize about customers is how we find out what the customers need and what the customer values. As a community action agency, we can't assume we know what the customer needs or what the customer values. Because if we do that, we are not really finding out from them directly. We are, of course, assuming. And to do that, it does not fulfill our mission primarily, but it also sets us up to where we may not be providing the services that are really needed in the community. So he tells us that we need to go out there and we need to solicit that information from our customers using what we're calling here maximum feasible participation. And that's what this workshop is about being able to get out there and solicit that maximum feasible participation. So when we do this, we look at assessing. We all do assessments. We know we have to do the assessment, our community action plan, every 2 years. So what do? We go out there and we present this plan, and we use the Roma Cycle to do this. We assess, we plan, we implement, we look at our achievement or our results, and then we evaluate those results and we reassess. So Drucker also tells us that we really need to be focused on doing this constantly because our clients don't remain static. Their needs aren't the same every day or every week. So we need to constantly reassess and look at our customers, ask for their input, and then provide the services based on that input that we receive. We have to do this constantly. So what does that mean for us as an agency, Community Action Partnership in San Luis Obispo? Well, we realized after some self-assessment of our agency that we were not really soliciting the correct information in the correct way. We were assuming what our customers needed, and we were assuming what our customers valued. Not completely, but we saw that there were some gaps there in what we needed to do and what needed to change to really look at what our customers needed and what they valued. But we also realized that we were sort of status quo. We were comfortable with who we were and who we are. We knew we were good at what we do. We've been doing it for almost 50 years now. So it gives sort of a feeling of comfort when you are doing things well, time and time again, and things are going well, and you think you're doing okay. But what we realized through our self-assessment and looking at ourselves, we really wanted to do better. We wanted to do great. We wanted to be great. I know you know who Jim Collins is. He wrote a book called Good to Great. And we really want to move in that direction and sort of not be satisfied with being good. We want to move to the great. So to do that, we knew we had to make some changes. And when we make changes, there's all sorts of things that come up when an organization embarks on change. We all know what happens. Everybody feels like, I don't want to do this. Like the cat here in the slide. It says, I tried change once, I don't want to do it anymore. And I'm going to talk a little bit about some of the phases and some of the things that change brings about and the cultural shift that you're going to have to go through when you make this change. So you'll see on the slide that there are 4 phases of change: denial, resistance, exploration, and commitment. These 4 phases are very distinct and different, but they have similarities that you'll need to be aware of when you start to move forward with the changes that you're going to need to make. And if you look in the lower left-hand side of the slide, there's denial and resistance. And these 2, although pretty different, they have a similarity of the fear of the unknown. Resistance will come up when people don't know what's going to happen to them, don't know what's next. And denial, they'll deny that they want to make this change because they are fearing what's going to happen. What are they going to have to do different? How much more work am I going to have? Is my workload going to change? Is my job description going to change? So there's some similarities there, which you'll need to be aware of as you move through this process. If you look to the upper left, denial and commitment. They don't sound the same, but there are some similarities there. And one of the most important one is that this is sort of a quiet phase. People can commit, but they won't actually say to you that they're committing. And people will deny, and they'll keep quiet. And you won't know if they're denying or committing. So you need to be very careful about this phase, and don't ever mistake quietness for acceptance. Because a lot of times, when somebody's being quiet, you can't assume, or go back to the assumptions, you can't assume that they're accepting what you want to have happen. And if we move across to the commitment and exploration phase, those 2 phases there, they're characterized by acceptance and curiosity. They're committing, so they're accepting what's going on, and they want to explore. You know, they're curious of what's going to happen next. There's a sort of excitement that starts to build when you move into these two phases. And then finally, the exploration and resistance. This is a time, resistance and exploration is a time where you're going to start to hear some noise. On the resistance side, you're going to hear expressing why they don't think this is a good idea, why I don't want to do this, why it's not good for my program. And the exploration side of it, you're going to hear them saying, yeah, this looks good. I'm happy. Let's move forward. What can I do to help? Here is where you really want to, especially leadership, needs to have their ears open and listen to the conversations that are happening. When you have resistors who are expressing it to you, and they're able to express it to you, and you can hear them talking, make sure that they understand what they're saying is valued, and that they're a part of the process. That's really important when you have resistance and they're being vocal. Let them be vocal and listen. Don't just hear them, listen to them, let them speak. And that way they feel that they're valued and they're a piece of the process. And there's also an opportunity for leadership to maybe garner some new ideas. You might be moving in a direction of change, and a resistor might have an idea that might work well with the change. So don't be afraid to listen to them and accept what they're saying. Organizational change also means cultural shift. You're going to be shifting your culture as an organization because of the change that you're going to be taking. And culture means a lot to an organization. It can make it or break it. It is very important to the success or failure of an organization as a whole. You need to know your culture. You need to realize what your culture is. And you don't want to sugarcoat it. Don't put on the rose-colored glasses and say, we're fine, we're okay. Be honest with yourself. Have your leadership team be honest with themselves and let them know that, okay, we need to do some changes here and there's going to be a cultural shift and this needs to happen. A good culture has the ability to enable and energize an organization, A bad culture also has the ability to drag the organization down, lessen productivity, and cause unrest. So again, be very aware of your culture, get to know your culture. Some do's and don'ts of cultural change and cultural shift. Some of the do's that you want to think about is make sure that you have a clear vision when you embark upon this. You want to make sure that you publicize this vision and that you do it rapidly and forcefully through leadership storytelling. Now, what I mean by storytelling is you don't want a bunch of numbers and charts and graphs. I mean, they're important at certain points, but when you're trying to portray the vision that you want to have happen and where you want your organization to go, you want to use storytelling. And that is getting personal and putting it in words that people will understand and will feel comfortable with. You also need to identify core stakeholders and express this new vision to them and make sure that they are continuously and systematically responsive and looking at these stakeholders to include them in this change that's about to happen. You want to introduce and consistently reinforce the values and transparency of this continued improvement. And another important piece is don't just communicate your vision vertically. Make sure that you communicate it horizontally as well. It's extremely important in an organization. Some of the don'ts. When you embark on this, don't look for wholesale change right away. Don't bring a group of management people in from outside or whatever. Look for those within your organization that have the ability to be those champions of change that you're going to need when you move forward. You might have to make some changes down the road that will probably be imperative, but don't parachute in a team right away. Use the people you have. You have talent in your staff, on your payroll, that can help you move forward and enact this change. I look at this as being, there's three types. There's those on your side of the fence, those that are on the fence, and those that are on the other side of the fence. You may not get everybody from the other side of the fence to your side. You can surely get most of the people on the fence, but use those ones that are on your side of the fence to help you get them over. It's really important to use those champions of change. And then finally, as I spoke, to being aware of your culture, paying attention to the shared values that your staff has, your employees have, your stakeholders, your community. Really make sure that you allow them to express themselves and allow them to tell their stories to you. Assess your culture, look at what should stay, look at what should go, but also look at what's missing within your culture. That's really important. Share your vision with everyone. Constantly cast your vision. Sort of an analogy I use is, I'm a fly fisherman and I constantly have to cast my fly out to the water to catch the fish. Think your vision that way. Think of your vision that way. You need to constantly cast your vision out there all over and over again so that it's heard, it's transparent, and it's understood. And then finally, you need to model the culture that you want to create. You want to walk the talk. So these are some things that you need to look at and be aware of when you start to move through a process of change within your organization. Some of you may have some major changes to implement some of the things we're going to talk about. Others may have just really minor changes. But be aware that change can be difficult, but if you remember some of the things that I talked about here, it can be a pretty smooth process if you do it right. So now I'm going to turn it back over to Grace, and what she's going to do is she's going to go into the nuts and bolts of how we did what we did, the change that we enacted, and the results of that change, and looking for that maximum feasible participation. Thank you.
Thanks, Bob. So now we are going to get into the nitty-gritty of this whole presentation. One of the things that our organization realized fairly quickly as we got into this process of collecting consumer data and beginning to analyze it and really look at what we need to do, always focusing on being systematic, being agency-wide. These are pathways to excellence terms, but are really terms that will help us as we move towards making larger organizational shifts in our service delivery, is realizing something that is pretty common, I think, to many organizations, especially to community action agencies, but we call that the silo effect within our organization. And essentially what that is you've got a number of programs, and the staff are very focused in on their programs and their customers and their service delivery. And that's great. But when it comes to looking at an organization from an agency-wide perspective and getting systematic data that covers all of your programs, that can be very difficult. So we knew we needed to address that silo effect. We also needed to know that we needed to get maximum feasible participation from all of our customers. Again, I talked earlier about our customers are not just our low-income consumers. Our customers are our employees, our funders, our partners. So how do we get maximum feasible participation from all of our groups? One of the ways is by creating the Employee Council. Now, the Employee Council is something that is really an excellent idea, but an idea that's usually difficult in most organizations to implement for a variety of reasons. Obviously for us, Community Action Partnership of San Luis Obispo County, we're a large organization. We span 11 counties. We have, at certain times of the year, almost 1,000 employees. And so it's very difficult when you think about how are you going to get a council that's really representative of all of your employees throughout your organization. But the role of the Employee Council can be pivotal in getting consumer input, because these employees ideally will represent not only their fellow employees, but will also be able to provide input and recommendations about their customers' needs. Who knows your customers, besides your customers, better? Obviously, your line staff, the people that are there working with them every day. In addition, one of the important roles for our particular Employee Council was because of information that we gleaned from our most recent strategic plan, which was actually 3 years ago. We're about ready to embark on our new strategic plan. But one of the main issues that came up from the employee surveys at that time was a sense of a real disconnect between the line staff and leadership. And so the Employee Council addresses this in that they are a conduit for information from the bottom up to the top down, so to speak. So they really represent a number of important factors here. Our Employee Council represents, of course, the customers that we serve. They represent their fellow employees. They represent an excellent conduit for information to the board of directors, to the leadership. They play a very important liaison role. So that was one of the major issues that we looked to bring up. The next was we began to look at how are we going to get this input? It's very easy to think about, well, we just go ask people questions. But when you're looking at agency-wide, systematic data gathering, it becomes a much more complicated issue. And so one of the first things we did was we looked at other pathways to excellence organizations. Specifically, we thank Eastern Idaho CAP, who won the Award for Excellence a couple of years ago, and they were great in terms of giving us information, forms, a lot of help. And one of the things that they helped us with is really looking at surveys. Now, we're a very different organization in terms of we're much larger, but some of the basic strategies, I think, are applicable to any size organization. So if you look at this slide, you'll look at the survey processes. The first thing we wanted to look at was our external advisory group input process. Now, your external advisory group is really your low-income individuals and community groups. One of the things you want to be very careful is that you don't have your external advisory groups only be comprised of folks who work with the low-income people. And that was actually something that we did. We made that mistake. Is we went to several groups. One was a group that represented low-income senior programs. And we started asking them all kinds of questions about services that they felt were needed in the community. And it was wonderful. We thought we were doing a great job. And then I mentioned to Denise Harlow back at the National, oh, we're doing this great external advisory group process. And first question out of Denise's mouth was, are there low-income consumers in that group? And I said, well, no. And she said, well, then it's not really an external advisory group. Because again, you're asking people who are working with those individuals, but don't you want to ask the individuals themselves? And so we took a moment and stepped back and said, yeah, you're right. And so as you look to get external advisory group information, one of the things that you want to look at as an organization is, are there already groups that you're working with? And this is above and beyond your parent councils in Head Start, because that's a compliance requirement. We're looking at groups that you want to perhaps recruit that will represent the income or the low-income individuals that you serve. So what we did was we then looked at 5 questions, we'll go to the next slide, that would be applicable across the agency. So now we're dealing with that silo effect. So here are the top questions. What are the top 3 community concerns that you and your family have? The gaps. What do you expect to see in terms of available services? Are there geographical gaps? Because I know in our county, we have a kind of literally a geographical gap in, it's called the Cuesta grade. So you've got north of the grade or south of the grade, and there are gaps in services depending upon where in the grade area you happen to live in. And then we ask the question of how effective do you feel that our organization has been in addressing these issues. So you can see here, it doesn't really matter what particular program is asking the question. These questions are not program specific. So that's how we address the silo issue. So we took these questions, went back, and this was actually a survey that we developed on SurveyMonkey, which is free. It's actually, I think if you want to pay a little bit extra, it will do more data analyzing for you. But we emailed this 5-question survey to the participants after there was an initial presentation or discussion by our planning staff. Now for us, our planning staff consists of 4 people whose primary role is to write grants, do the CAPs, do reports, do data gathering. So this kind of duty fell naturally into this particular group. If your organization does not have a planning department, then you need to really look at where this entire process of survey, collection, gathering input, where is it going to lie? Because it has to lie somewhere with either one individual or a group of individuals who will take responsibility for shepherding this process all the way through. So if you're a smaller organization, you might have a program director. If you're a larger mid-size, let's say mid-size organization, you might have a group of program directors that will agree to come together on a fairly regular basis to look at shepherding this process through. But you're going to need to decide fairly quickly in the process of where this entire process is going to lie. So for us, our planning division emailed the survey to these groups. They gave them a 30-day response period. And so there was an initial kind of email that was sent to, let's say, the Aging and Adult Advisory Group. And there was a little preamble that thank you for taking the time to address this survey, any kind of specific information about your organization, letting them know that it's an anonymous, confidential survey done through SurveyMonkey, and the link to the SurveyMonkey was given to them. So at 30 days, the planner would close that survey. We do usually send a reminder email at 15 days, just to remind people, because things tend to get lost in the email process. At 30 days, that survey is closed, and the planner creates a report. The report then is sent to that particular program director and to the employee council. So for us, because we have a number of different programs, we run these surveys once a year for a 30-day period per program. And I'm going to show you something visual in a little bit that will hopefully make a little bit more sense. But because we have 16 different programs, we realized that it would put an undue hardship to do these surveys year-round or to do them all at once. And so what we did was we determined with the program directors what the best month would be to send surveys to their partners, to their external advisory folks. So for example, we have an energy services division. So energy services says, well, the best month to do a survey to our funders is March. Health services may say, well, the best month to do our survey is when the kids are still in school. So do that maybe in October. And so each planner has a calendar of when their particular program runs their particular survey. So as you look at your own agency's capabilities, the number of programs that you have, the number of staff, and the number of participants in those programs, you're going to want to decide, are we going to run surveys year-round? Are we going to do it for a finite amount of time? Are we going to survey everyone in that 30-day period? Or are we going to survey only a subset? Those are the questions that you need to decide based upon the size of your organization. As you can see, this external advisory group process meets standards 1.1, 1.2, 1.3, 2.2, and 6.4. So there's 2 additional surveys that need to also be done. One, obviously, is our low-income customer survey process, and the other is our partner funder community survey process. Again, remember, our customers are not only our low-income consumers, they are our employees, they are our funders, partners, community members. So the low-income customer survey process, as you can see here on the right, is a little bit different. There were 8 questions, and I'm going to go to that slide. And again, I'm going to thank Eastern Idaho Community Action for providing us with this survey. The questions are generic, again, can be applicable to any program. What we decided to do, because we had a number of programs with a lot of clients in them, is that we developed this Scantron document. And I must recommend Survey Systems. It's in Minnesota. They give a great price. They're wonderful to work with. And they developed this Scantron document so that we would be able to provide our customers with a copy of this document. So it's essentially a large postcard-sized document. On the other side has our address if the survey is going to be mailed back to us. But in some cases, for instance, in our Head Start programs, we have a locked box that actually sits in our classrooms, and the parents can come in and drop that survey into the lockbox. So looking at your particular programs and what would be easiest for those customers, you always want to look at what's the most efficient and effective way to gather this information. So what's going to make it easiest for our customers to respond back to you. In our energy program, for example, our weatherization folks go to low-income individuals' houses. They will hand them the card. And we do a self-addressed stamped card so that folks know that they can just complete the card on their own and drop it in the mail. We pay the postage because that's the most convenient way to get that to them. As I said, for Head Start, different story. It's a box at the counter. In our homeless services program, same thing. We actually hand the card to the individuals, but it's not stamped. We have a box by the door when they come in and they can drop it in. This is also in Spanish and English, so you need to make sure that you cover all of the populations that you have. For smaller programs who don't necessarily need to do a Scantron, what Eastern Idaho did was they just color-coded. So one program, the postcards were blue. Another program, they were orange. And that's how they were able to tell which program was which. If you're Scantroning, you can easily number the numbers of cards that you give to the staff. So for example, again, in our health services division, they decided that they were going to do a random sampling of clients who walked in their clinic over a 30-day period. So they got 200 surveys. So we were able to hand them numbers 0 to 200. And we would know then that those cards were around health services. So depending upon the size of your organization and the complexity of the numbers of locations, you're either going to want to do a Scantron, you're going to want to stamp it or not, you're going to want to hand deliver it or not. All these various things you want to think about. The most important thing you want to think about is what's going to be the easiest way to get these cards back. We actually have had phenomenal success in getting these cards back because we really took the time by program, by talking with each program director, by talking with our employee council and asking them what's the best way to get information from the customers in your particular program. So if you look through these 8 questions, very simple, again, can be used no matter what program you're in. The only way that you would get a name is if the customer chose to answer question number 6, that they would be willing to participate in a discussion group. That's when they would put their name and number. And actually our employee council looks at these cards, and if there are individuals that do choose to be contacted, employee council members will call them back. And we have a set of questions developed by the program to ask those customers how we could better serve them. So now we go on to the partner funder community survey process. So those are 5 questions. Again, those questions are now tailored more for the individual program. So as we look at that, funders, what types of questions are going to be important for a funder to ask? Well, is our staff effective in working collaboratively? Funders now want to know, what evidence of collaboration are you doing with your partners in your community? Is your program staff creative and innovative in developing and sustaining programs? Do we operate with integrity, and do we use ethical practices? What are the program's strengths, and in what areas could the program be improved? Now, one of the questions we got from someone in the audience at the CalNEVA was, well, what if your funder is Health and Human Services? Well, obviously, unless you have a close relationship and a contact person, you may not get a response. So we ask the programs, what funders do you have that you have a relationship enough that you feel that you would be able to get the information back from them? So we ask these 5 questions. We do the same 30-day survey period. We do the online survey via SurveyMonkey. We close the survey at 30 days, so it's the exact same process as we used to get input about our community needs from the external advisory group. The report is then emailed to the director of that particular program and the council, who look at it, who incorporate that data into a larger assessment that we do with our board, and that information gets sent right up to the board. So as you can see, these surveys meet a number of different standards. I wanted to show you an actual report that was compiled and given to our employee council and the program director of a particular program. This was, I believe, in our Migrant Seasonal Head Start program. So we had 694 respondents, and we were able to tally, actually it wasn't us, it was survey systems that tallied all of the information and listed the number of yeses, nos, NAs, and no answers. And again, it's pretty consistently positive. One of the things that we noticed actually amongst a number of our programs as we began to get more and more of this client satisfaction data in were the answers to question number 4. In many, many cases, our clients were not informed from our staff about other CAPSLO services or other community services. And as our employee council kind of dug a little bit deeper, what we found is that a lot of our staff don't know about other services in our agency. That's because we're really big. And again, that addresses that siloing that is fairly common among community action agencies. So if you ask me about my particular program, I got it down. But if you ask me about a different program, I don't really know. And so one of the things our employee council is doing is they are embarking on a whole series of meetings amongst programs to educate programs about all of the different services in the agency. We've instituted an agency e-newsletter that comes out once a month that talks about, highlights a program a month, gives an actual client story. So these are ways that we're looking at systematically, agency-wide, communicating to our customers, who in this case are our employees, about the services that we offer. So community groups, what does that survey look like? Well, again, there's specific questions that we would want to know from our community groups that we work with. Do we have a positive image in the community? Do we play well with others? Is our staff qualified and competent in performing their jobs? Is our staff respectful and timely in their interactions with that particular organization's staff or their clients? And again, what is the program's strengths and what areas could be improved? Now, This survey and evaluation process looks very, very overwhelming, but it really isn't. And it's very helpful. If you come into our planning office, you will see 3 large dry erase calendars up on the wall. And on those calendars, you will have colors that represent the particular planner, or if it's a smaller agency, a color that represents a particular program. And when you look at how you are going to systematically begin to do these surveys and collect the data and begin to evaluate them and send that information up to your board of directors, you really got to look at the timing around all of this. So for us, what we did was we worked backwards from a board meeting, which is sort of the final stage, I guess, in imparting information about our customers. So if you look at the far right star that's labeled number 4, that is the date of our board meeting, and also it's actually the same date of our board planning subcommittee. They meet a few hours before the board, and the planning subcommittee is really responsible for looking at all of this data. So if that board meeting always falls on the 3rd Thursday of the month, then we go backwards, because if our employee council and our program director are going to review the data, make any recommendations, provide any input, ask or answer any questions, we've got to make sure that they have time to do that and get it to our board. So if you look at star number 3, that is when our employee council meets, and that is the deadline for imparting information to them, getting information from our program director, so that we have time to compile that and email it all out to the board of directors. Looking back now at number 2. Remember we talked about client satisfaction surveys, partner surveys, funder surveys close at the end of a 30-day period. So we have to go back and go, okay, how much time do we need from the time those surveys close to mail the information to survey systems, to close the SurveyMonkey process and create a report? How much time is needed to do all of that? And our planning staff said, well, at least a couple of weeks to do that. So if you look at the time between numbers 2 and 3, you've got only a couple of weeks. And then going back even further to number 1, that's that 30-day period where it all starts. So number 1 is when we actually start the process. We hand out the surveys, we email the surveys, whatever we need to do to best get that information into the hands of our customers. So if you look then, it's almost a 3-month process from start to finish. And what's so important is as our planners look up on that board and they can see their color, because what we'll have here is we may have several different surveys going on at the same time because we have so many programs. But my one planner, Bryn, her color is green. And so she looks up on the calendar and she sees, okay, where's their green this week? What do I need to do, if anything? And that's how they kind of keep themselves on track to make sure that they're shepherding this entire process. And so finally, that's the internal process for our staff to make sure they get the data to the board of directors. So how does this all fold out? Well, ideally, at around the same time, you've got the 3 levels of surveys. You've got your partner funder community survey, your low income survey, your external group survey going on. Those results go down to the employee council, and then over, if you look over to your left, it's also going to your program director. So there's input from the program side as well, which is the middle management level, because we need to make sure we get their input and their suggestions, as well as the employee council. So there's a back and forth that needs to go on. That information then gets compiled into an actual report that goes to the board of directors subcommittee, that planning committee. They then look at that information and they may send more questions back up to the employee council, to the program director, to the staff, wanting more information about certain data. Or they may say, great, We're going to move this on now to the board of directors, and we're going to provide a report about these customers' needs, this customer satisfaction survey, and what, if anything, the directors are going to do about addressing some of the issues. Then the results are trended annually. So once a year, we start the process over again. If you look over to the right, the big star, ideally this is all part of a larger community action plan and strategic planning process. Because remember, as community action agencies, we are responsible for conducting community action plans. So going out into the community, conducting focus groups, individual interviews, questionnaires, whatever we can to capture as much information about our local community as possible. That community action plan ideally serves as the foundation for the development of the strategic plan. The strategic plan ideally has not only your community action plan information and data, but also has the data that we've just talked about, the external advisory group information, your employee survey information. Remember earlier I said that one of the main things that came out of our last strategic plan from our employee survey was that sense of disconnect, was that sense of communication being a little bit difficult between the levels. So it's important that you look at the information that you're surveying, and that goes into your strategic plan. So again, you're demonstrating that not only are you gathering input from all of your customers, but you're doing something about it. And it should show up in your strategic plan. And then you assess that strategic plan. At my organization, we assess it formally every 6 months and actually present to our board of directors an update on what progress has been achieved in terms of those plans. Obviously, as Bob talked about, Roma is our foundation. And as you can hopefully see through this process, is we are following the Roma Cycle. We're assessing through our external advisory meetings and surveys. We're assessing what are the needs in our community, how can we best address them, or in some cases, are some of the programs that we're providing no longer relevant? It's important to look at that too, and to be open at letting go of things if they're no longer relevant or needed in our community. And then after we assess, we have a planning process. So what are we going to do with these assessment data? What are we going to do with these unmet needs? What's mission relevant? What isn't mission relevant? Do we have the ability? Do we have the resources to address these needs? Then we implement where appropriate. We begin a new program, we begin a new process, we end a program, we end a process, we implement, we actually do something. And then we look at the results on a systematic, agency-wide perspective. And then we evaluate. How did we do? How did we do? How did our customers say we did? How did our partners and funders say we did? How do our employees say we're doing as an organization? And then we begin the process all over again. So now that I've given you probably way more information than you ever hoped to have, we're going to turn it over now to an actual case study. Some staff and peer leaders in our Paso Robles Teen Center are going to talk about how they gathered input and data and information from their consumers, their customers, their funders, their employees, to really look at an unmet need in a rural community here in San Luis Obispo County, and how they turned that input into action by developing the Teen Resource Center. So I'd like to introduce now Jill Billich. She's our Community Action Partnership staff member.
Thank you, Grace, and welcome to the second half of our presentation. My name is Jill Billich, and this is
Brianna
and
Elizabeth.
And we're here to talk to you about our program, the Teen Resource Center. I'm the coordinator for the program, and these lovely ladies are our peer leaders at the Teen Resource Center in Paso Robles, California. We are a program under the Health and Prevention Division, youth programs within Community Action Partnership of San Luis Obispo, which you've heard a lot about already. And just to give you a little background on our programs, we have quite a few of them. The Teen Academic Parenting Program is one. That is a program that supports pregnant and parenting teens, both academically and in parenting their children. We want to set them up for success in as many ways as we possibly can. We also have the Youth Empowerment Program, which is focused on reproductive health and sexual health. We do education in the schools. with an evidence-based program. We also have the Youth Advisory Group, which is under the Youth Empowerment Program. The Youth Advisory Group is an example of an external advisory group. This is a group of teens across our county that come together and advise us on how we can improve our programs, improve our education, improve our outreach, so that we can best reach our customer both educationally and just in relationship. We also have the Teen Monologues Project, which is a theater project, which has been just amazing in reaching out to the teens across the county. We use the stories of real teens from our area and explain how difficult it can be to be a teen when it comes to reproductive health, relationship issues, and their sexual health. So this is an amazing piece that we just love to share with as many groups as we can. We also have the Project Teen Health, which is focused on obesity prevention and education around nutrition and exercise. And then we have the Teen Resource Center, which you are going to hear so much about today, and we're really excited to bring to you. The common thread throughout all of these programs is that we are constantly trying to collaborate with as many groups as possible who are serving a common population as us or serving a common need. So some examples of our collaborative groups that we work with are the Teen Pregnancy Prevention Task Force. This is a group that we actually lead, and it is another example of an external advisory group. When we make changes in our program, when we develop new programs, we always bring it back to them and we ask for their input. We are constantly asking them what they're hearing from the teens that we also serve, because we want to get as much of a broad picture of our community that we're trying to serve as possible. We also are a part of the Paso Robles Community Collaborative. This is just another chance to connect with those individuals who are also serving youth in our community. The Prevention Alliance is another, the Link Community Collaborative, and finally the Youth Empowered Services. Youth Empowered Services is a group that we rely heavily on when it comes to this specific program, the Teen Resource Center. The Youth Empowered Services was established in 2011, and they focus in northern San Luis Obispo County, and their mission is to unify the collective strengths of the community in order to provide youth with a sense of empowerment, purpose, and belonging. So this just hits exactly what we want to do with the Teen Resource Center. We want to make sure that we're empowering them and that we are just really helping them feel like they belong somewhere. The members involved in the Youth Empowered Services range from schools, school staff, to probation department, Boys and Girls Club staff, the different private foundations across the county, faith-based groups, and other youth-serving providers. So with this group being so tied to the goal of empowering youth, we realized that one thing that was missing was the voice of youth. We sit together around these tables and we talk to adults, but we really wanted to really empower them by hearing their voice. So if we want to empower them and serve them the best way we can, we need to hear from them. This is what began our search for the teen input from the northern San Luis Obispo County teens. We started with a teen forum. This forum was just a chance to bring together youth from all over northern San Luis Obispo County. We had all the program leads right there at the table, and so we decided, why don't you invite some youth, you invite some youth, you invite some youth, and we'd have a great group to pull information from. So we had an amazing space, which we would later become the home of the Teen Resource Center, and we had all these amazing people. The one thing we needed to add was food, because we know that teens will always come when you bring food into the picture. And so we supplied dinner. We just spent time asking them questions, digging deep with them, understanding what exactly it is that they need from their community. What's missing? What are we doing well already? and what can we improve on? So this was an amazing opportunity back in January of 2012. And then following this, we also did a Healthy Kids survey. This survey was distributed in the schools across northern San Luis Obispo County and the rest of the county as well, but we really focused in on the results from that area so that we could understand how we can best serve them up in that area of the county. From these two, we were able to get so much amazing feedback. We found out that what they really felt they needed was jobs. There's not enough jobs that are serving San Luis Obispo teens. So that was one key need. Also, they wanted a safe and fun place to hang out where there wasn't alcohol or drugs involved. They hope for this, but sometimes it's one of the only options they have is to go to a party where that's going to be present. They also needed a quiet place to do homework. Many of them at home, that's not an opportunity to have a quiet space to sit down and just focus in. So they wanted that provided. They also needed free and affordable food and activities, which is something that came to the forefront multiple times. So many different teens mentioned this need. And then they also wanted a place to perform both arts, music, dance, etc. So from these needs, we had an idea. We wanted to meet these needs that they had uncovered for us. So we came up with an idea that we then needed to find support for, both financially and through research. So we met with our planning department, who helped us uncover a funding source that would fit this idea that we had. We also collected data and information research that supported the needs that these teens had already uncovered for us. And then we applied for that funding. And through this whole process,
the Teen Resource Center was born. It's a fun and safe place for confidential teen support. Our mission statement is: we believe in the ability of youth to succeed and positively impact within our community. We serve ages 12 through 19, focusing on teens that are living in poverty, single-parent homes, gang-affiliated, etc. We are open 4 days after school. Our distance is close to a middle school. We are also a drug and alcohol-free environment. We schedule many activities and parties and events. For example, we have summer bash party, we had friendship party for Valentine's, and we have tons of other events. We also have arts and crafts materials that our teens would need to create cards.
For example, in that picture, we have our staff, the peer leaders, coordinating with the teens over some arts and crafts materials, and that actually was when we were doing the Valentine's Day party. And it allows us a nice time to sit and talk with our teens and get to know them on a deeper basis. So we also provide employment. So one of the needs was jobs within the community. And so the Teen Resource Center provided 6 paid positions for staff, and we were trained over summertime throughout all the community. And we also provide community service opportunities and partnerships with others. So, for example, we provide through One Cool Earth, we have gardening, and we also provide CPR and for the community and community service opportunities that relate to the teens.
In the first picture we see, we are being trained to be CPR certified. It wasn't only just open for us as peer leaders, but it was also open for everyone outside of school or students. We also have community service, and we have our students serve them in the place that best fits them. For example, we have my brother, actually, DJ Luis, and my cousin Willie. In the next picture, we have some of our students doing planning work. Us as peer leaders connect with our youth that come through our doors on a daily basis. From them, we build relationships, and that helps us connect them to services that they need within our community. They also look up to us, like we're going to school, we're working. They see that we are planning to go to college. They ask tons of questions, and we answer them.
So we have a picture of me, a peer leader, and one of our others, Maria, sitting down talking to a bullying victim, Avery, and we're doing arts and crafts. So the fact that we're doing arts and crafts gives us a pathway into how to get in more in depth with her life. And so she opened up to us a lot that day about being bullied and how she dealt with it and how she moved on. And it was showing a really strong impact on her that she could open up to someone finally about it. For education and future planning, we provide computers for quiet, safe place to do homework and resume building and personal needs. We also help with homework, so if a student came up to us and asked us for algebra help or geometry or science, we provide that. And we've done a college visit to Cal Poly to help them explore their options in college.
In one of the first pictures here, we see one of our peer leaders helping one of our students achieve their homework. And we also had a Cal Poly trip, which Brianna was talking about. And that inspired them to actually go to college, major in something, and just the adventure of actually being in the place where students were around, that were going to classes, and were studying. We also provide free and healthy snacks from the food bank. We also partner with public health to do food prep demonstrations. We also encourage our students to make healthy food choices and nutrition education.
So in the pictures below, we see me helping the students make quesadillas. So we make quesadillas, smoothies, and other various things. And it helps them learn how to make food that's within their fridge. And also it's cheap for them and for us to make. To provide the help we need for the teens, we have continuous customer input. And we do this through satisfaction surveys, which are provided through Community Action Partnership. And it's a survey that gets on the level of things, like the space is clean, or if we're helping the students the way they need to be helped. And we also have peer-to-peer group interviews in which we sit down with all the teens and ask them what they would want from the day, activities for the day, month, or year. And this helps us get what they want to do. So volleyball, tennis. We also have a suggestion box, which is they anonymously put hints to us. So about rules, activities, community service opportunities they would want with it. And it's all completely anonymous. And focus groups between staff and participants. So through the satisfaction surveys, if they left a name and number, we would contact them and they would be sent into a focus group where it gets the in-depth levels. We dig deeper and figure out what they need from us and what we're doing well. At the end of each day, we have staff check-ins and we share feedback with each other about what happened and if any teens had an incident or if we figured out something that others do not know, because we're all in different places at every single time, and it's really fun for us to sit down and talk to each other for a second, take a breather. And another way to communicate with the staff is our communication journal. So we have a journal where we all write in at the end of each day, and it allows us to connect with the other staff that are not on that day, so it really helps us.
In this picture, we actually have one of our peer leaders, Elizabeth, writing on our communication journal, letting the rest of our staff know that she experienced a case with two of our students, girls. They had drama that had been going through for so long, and teachers would just say, just be friends, and nothing was solved within there. So she talked them through, and they resolved the problem, and they actually became really good friends.
So with this customer input, we decided to change the program. So we train the staff on issues that we see that arise. So one of our participants, a couple of our participants came to us about bullying, and they were being bullied at school and within the community. So we decided to train the staff. We had a training open to the community, a step-up training, and it helped us provide communication and intervention trainings, and it really helped us with attacking the situation that's at hand. So we go about how do we talk to the student, how do we get the bully victim and the bullied to sit down with each other and talk about what the real issue is.
This training was actually really helpful because we were able to manage relationships with our students and actually also with our friends to have built healthy relationships.
So we also add activities through the customer input. And so one of them was that the snack was not sufficient enough for them. And so we provided food demonstration and cleanup activities. And this helped learn how to cook food and how to clean up after themselves, because some of the students didn't even know how to wash a dish. Like cold water and put it into the drying rack and it's clean. And so this helped them learn basic life skills.
We actually had a smoothie demonstration, and we added spinach to the smoothie, and we had one smoothie without the spinach. And they thought they wouldn't like the one with spinach because it was spinach and ew. But actually they came up that they actually loved the one with spinach because they hadn't tried it.
A little more than the one without spinach too.
Yeah.
And so we modify existing projects. So one of our existing projects was a monthly open mic night. As a staff, we decided this would be a really cool idea. Like, we could have bands, poets come in, everybody from the community just come in and celebrate 1 month, a one-time month. And it did not turn out well. Nobody really showed up. But the students in our center decided that they like to sing and do monthly karaoke. So we opened that up, but the demand grew and grew and grew, and we turned it into weekly karaoke, where one of our students, Noah, decided to sing Hips Don't Lie by Shakira almost every day. And it turns into a competition, who could sing the best and who could sing the loudest, or what songs they would like to sing for the day. Okay, so another modifying existing project that we had was our teen discussion group. So we sat there and we're like, the teens need somewhere so they could sit and talk. And we decided a discussion group to help the community. We planned things like how to fix this problem in the community and how to go about solving it. So no one showed up at all. And it really was like, we had issues, but while we were talking about this, bullying started coming up more and more within our participants. And so we decided to get a therapist-led support group by community counseling centers, and they helped us by having the sit-down person to lead a group discussion, and it helped the students open up to us. And at first we decided, okay, this would just be an on-the-line thing, like what's bullying and what's a bully look like, what is bullying, and the students got really in-depth about it and started talking about their past issues and brought up issues within each other, and then they resolved it, and everybody was happy at the end of these 4 Mondays.
So as you can see, in our programs, we're constantly taking customer input and implementing it into our programs. We modify existing programs, we start new projects based off of that input. Another tool that we constantly utilize is our community partners' voice. So we find it very important to find out what they think about our programs, how they think we're doing when it comes to serving the youth of our community. So for this, we did a survey much like the one that we gave to our customers. This was a chance to gauge our responsiveness, as well as the staff's competency on how we really run our program, as well as how effective we are in working collaboratively with these other programs. We also, lastly, wanted to find out what's our image like in the community? How are we doing, and how are people perceiving us? This survey was a great opportunity for us to hear from them. Another way that we listen to our community partners is by being a part of those collaboratives, like I said before. So the YES Collaborative, the Youth Empowered Services Collaborative, has been an amazing group to just bounce ideas off of. When we think about changing our programs based off of our customer input, we bring it to them. We ask them, what do you think about this? Do you think this is going to serve the youth that we are all here to serve in the best way possible? We also, once we've changed our program in some way, we bring it back to them and tell them what we've done and ask them for any additional input. So the way things work in all of this is we typically start with collaboration. All of our programs, like I said in the beginning, are very reliant on those collaborative partners. We want to connect with them because really that's our chance to hear what's going on among our youth. And we start with that collaboration, and then we dig for customer input, finding out what do they need? What does our community need, the people that we want to serve directly? And then we take that back and we create programs and make them in a way that's going to fit those needs that we've uncovered. And then we get their input as we run these programs, as we bring them to life. And once we've gotten that customer input, we make the modifications necessary in our programs. And lastly, once we've made those modifications, we bring them back to the collaborative. So it's much like the Roma Cycle that you've become very familiar with in the beginning part of this presentation. We just continue on this cycle, and it's been extremely helpful in everything that we do. So thank you for listening. Thank you for just being here and learning more about the Teen Resource Center and how we take that customer input and implement it into our program.
So, now you've heard some of the broader theoretical perspectives on obtaining customer input and involvement, and then you've seen an actual real-life example of how getting customer input and involvement resulted in the development of a program. So now what? So now what is, we're going to talk about the methods that we discussed at our conference. And since you are not at the conference, hopefully you'll be able to take this information now to your own agency and go into small groups. So the first thing we want to talk about is the methods that you're going to use. So what methods will you use in your organization in order to obtain systematic agency-wide input on what your customers value? And how will it include all of your customers? Are you going to be doing focus groups? Are you going to be doing one-on-one interviews? What specifically will you be doing? And then what steps need to take place to develop and implement these methods? Remember, who needs to own this process? You need to discuss that before you embark. Who on your staff do you need to involve? Where does this process begin? The second group discussion, what methods will you use to collect and analyze customer satisfaction data agency-wide? So electronic, written, will you have confidentiality? Will there be certain months? Will it be year-round? What is the frequency? What methods will you use? What steps need to take place to develop and implement these methods? What questions will you ask? Who's going to collect and turn in these surveys? What are going to be the specific steps that you take in order to develop and implement these methods? And third, what steps need to take place for your organization to form groups of low-income consumers that can recommend issues to your board of directors? Who do you want to ask? Do you already have a group? Perhaps your program managers are already participating in group processes. How will you recruit low-income people, and how will you communicate that need? So these are just a few of the questions that you're going to need to think about as you embark on this process. But you're not going to be alone. So thanks to Denise Harlow at the partnership, we've already set up a discussion board on the Customer Input Discussion Forum, which is on the CSBG Training and Technical Assistance site located at csbgtta.org. That will be an opportunity for folks to come on, ask questions, answer questions, help one another. On this site will also be links to all of the documents that we used, board action templates, survey questions, processes and formats, and actual language that we used in developing all of these systems that go into the process that we talked about today. You can also access these documents on our website, which is capslo.org. There will be a link that will take you directly to all of the documents that you will be able to use, hopefully, as you go into your organization and develop ways to obtain customer input and satisfaction. In addition, you can email me with any specific questions you might have. And my email address is gmcintosh@capslo.org. I'll be happy to answer any questions that you have. So on behalf of Community Action Partnership of San Luis Obispo County, I hope this was helpful information for you, and we look forward to having a discussion with you on the TNTA forum. Thank you.